Chapter 12, Conception and Prenatal Development. The fetal period is the 9th week after conception and ending with birth. A few major developments occur at different gestational ages. We'll go over the most common changes during these periods. Weeks 13 to 16, movements strengthen, so the woman who may have been pregnant may begin to feel these movements during this period. When a woman feels these movements, it is called quickening. During weeks 17 to 20, many women will feel fluttering or butterflies. This is those first movements as well, and this is the period that most first-time moms will feel movement. Brown fat is produced during this period. Brown fat is the heat-producing fat deposits to help regulate temperature. Locations for brown fat include the back of the neck, behind the sternum, and around the kidneys. Weeks 21 to 24, the baby is growing and the lungs produce surfactant. Surfactant is a lipid that reduces surface tension in the alveoli and the lungs. They need this surfactant to keep the lungs from collapsing. If born at the end of this period, they may survive, but many that survive will have multiple complications that can last their lifetime. Weeks 25 to 28, better chance of survival if born during this period. The fetus will typically get in the head-down position at the end of this period to get prepared for delivery. Weeks 29 to 32, pigmentation of skin according to the race takes place during this time. Chances of survival are greater during this period. Weeks 33 to 38, the growth continues until birth but will slow as it gets closer to full term. Lanugo is the fine hair that covers the body during earlier fetal periods and now during this time will decrease. Vernix is that thick white substance that protects the skin. It is in more abundance during the earlier fetal periods and not as abundant as the fetus reaches full term. The placenta is the baby's lifeline. It attaches to the uterus during implantation, and the other side is where the umbilical cord attaches. It's a thick, disc-shaped organ. The maternal component is the side that attaches to the uterus and provides nourishment to the fetus. It may also help keep fetal tissue into entering the maternal bloodstream. Blood is circulated to and from the fetal side by the fetal heart. The umbilical cord has 2 arteries and 1 vein. Remember AVA, artery, vein, artery. A function of the placenta is metabolic function. The placenta produces some nutrients needed by the fetus and synthesizes glycogen, cholesterol, and fatty acids. Another function is the transfer of substances. Gas exchange is a major function. The key function is respiration. Oxygen and carbon dioxide pass through the placental membrane. Another function is the passing of nutrients through the placenta from the mother. The placenta also removes waste, and it can transfer the antibody IgG from mom to the fetus via the placenta. Endocrine functions include the ability of the placenta to produce many hormones needed for normal pregnancy. There are 2 fetal membranes, the amnion and the chorion. These membranes are so close that sometimes it's hard to tell there truly are 2. They are what is known as the bag of waters. The amnion is the inner membrane, which is closest to the baby, and the chorion is the outer membrane, which is closest to the mom. When mom's water breaks, typically both membranes rupture. The amniotic fluid protects the fetus. It protects it by cushioning the fetus against impact to the maternal abdomen. It provides a stable temperature. It provides normal prenatal development by allowing symmetrical development of the fetus. It keeps the membranes from sticking to the fetal parts, and it provides room and buoyancy. The amniotic fluid comes from the fetal urine and fluid transported from the maternal blood across the amnion. The amniotic fluid is an ongoing process. The fluid will cross the amnion for absorption by the mom. Some fluid is absorbed by the fetal lungs with breathing movements and is swallowed and digested in the fetal digestive tract. The volume increases during pregnancy and by full term is about 500 to 1,000 mLs. Low amount of fluid is known as oligohydramnios, and it can be associated with poor fetal lung development and possible malformations. It may also occur because of poor kidney function, too, and they cannot excrete the urine. Too much fluid is known as hydramnios or polyhydramnios. This is when the level typically exceeds 2,000 mLs. It can be caused from severe malformation of the CNS or GI tract, which prohibits normal ingestion of the amniotic fluid. Review the fetal circulation on Moodle that was posted on a previous week. Your book also has good pictures explaining this as well. The umbilical cord has two arteries that carry blood high in carbon dioxide and other waste away from the fetus to the placenta. It is then transported to the mother's circulation where she can excrete it. The vein in the umbilical cord takes that nicely oxygenated blood along with the good nutrients back to the fetus. These arteries and veins are coiled in the umbilical cord, which allows for them to stretch. Wharton's jelly is a soft substance that encases the cord to prevent it from collapsing and becoming suppressed by pressure. The fetal circulatory circuit needs to change after delivery. While in utero, the fetus does not breathe air or metabolize substances. There are 3 shunts that bypass most of the circulating blood away from the lungs and the liver. The first shunt is the ductus venosus, and this is where about half of the oxygenated blood bypasses the liver and enters into the vena cava. This blood then enters the right atrium. Most of the blood from here will enter the left atrium through the second shunt, the foramen ovale. This is where the blood mixes with a small amount of blood returning from the lungs. The blood is then pumped from the left ventricle to the aorta so it can nourish the body. A small amount of blood from the right ventricle is circulated to the lungs to nourish the lung tissue so it stays healthy for after delivery. The remaining blood from the right ventricle joins the oxygenated blood from the aorta through the third shunt known as the ductus arteriosus. The head and upper body will receive about 75% of this oxygenated blood. As pregnancy progresses into late pregnancy, the liver will now receive 75 to 80% of the oxygenated blood. So after birth, things need to change. As the infants take its first few breaths, these changes should occur. First of all, with those first few breaths, the pressure from the blood flow increases and causes pressure on the right side to fall. This drop in pressure causes the foramen ovale to close. Pressure in the aorta now increases and pressure in the pulmonary arteries fall. With this happening, the direction of blood flow through the ductus arteriosus is reversed from the aorta to the pulmonary artery. The ductus arteriosus constricts as the arterial oxygen level rises. The ductus venosus also constricts when the blood flow from the umbilical cord stops. The foramen ovale and the ductus venosus permanently close, and the ductus venosus and ductus arteriosus become ligaments, along with the umbilical cord vein and arteries. Once again, the video on Moodle really gives you a nice visual of how this works. There are 2 types of twins, monozygotic and diazygotic. Mono are conceived of a single ovum and sperm that later divides into 2. They have identical gene makeup, so they are known as identical twins. Since they are identical, they must be the same sex. Most of the time they look identical, but there can be some differences. Mono twins happen randomly and are not linked with any associated reproductive techniques, such as in vitro. For most mono twins, they have 2 amnions, but they share the chorion. If the division occurs earlier, then they can be 2 separate sacs that implant separately. These twins have separate placentas, but often they may fuse together. In less common situation, the division happens later and they share their amnion and their chorion. So basically they are in the same bag of water. Death can be more common in these twins because their cords can become entangled. Remember, the cord is that baby's lifeline, so if it becomes entangled, it cannot do its job to provide fetus with the oxygen, nutrients, and remove the waste. They can also have something that's called twin-to-twin transfusion, and this is where one fetus will take all the nutrients and the other gets very limited, and also increases the risk of death in the smaller twin. Diazotic twins are from 2 ova that are fertilized by 2 different sperm. They are considered fraternal twins and can be the same or opposite sex. They may look alike or completely different. They are no more alike than 2 siblings born at different times. They can be hereditary. They have 2 separate sacs, their own membranes, and placentas.